Avril, I wanted to ask, when you work with preceptors who are going to be mentors to international students, how do you prepare them? What do you talk with them about?
Well, Steve, what we normally do is, we would go in, meet with our preceptors, but the important thing for us is to keep the lines of communication open and be transparent, as to how CFHI really works. And in terms of preparing our preceptors for our students, meeting with them on a regular basis, touching base with them on a regular basis, and sort of giving them, the sort of outlay of the program, its expectations, and at the end of the day, the goals and objective of the organization as well. Then we have the preceptor handbook, which is very, very helpful. And I have found that in most cases, all of our preceptors have gone through the handbook and can sort of give us feedback, I think the important thing is that, like I said, the lines of communication should be open, there should be transparency. And those are the things that sort of, if there's any problems, if there's any challenges, they have the freedom to pick up the phone and say, listen, this is what happened, how do you think we could work this out? So it's working out well.
Mm-hmm. What do you say when a student calls or comes to the program, you've already screened them, they've arrived, and they say they have a research project that they need to get done?
Basically what we would do is, like I said, we're in contact with the student at least 6 to 8 weeks before they arrive, so we are well prepared in terms of what they need to do. And a typical example of that was a Duke student, a nurse practitioner who came in, and we've been in contact for a very, very long time. So by the time she arrived there and she had, some research that she had to do, I would reassure, say that these are the resources available. If there's anything you need to do, please let us know. But at the same time, I would have contacted the preceptor and explained to the preceptor her goals and objectives. They have access to our library at the University of Cape Town, where they can do research, as well as the hospitals itself do have access to the internet. The other source of communication or tools that they can use to sort of finish their projects is to talk to our local healthcare providers, which have this wealth of knowledge and experience over the years. And these people are normally very, very receptive, and they like to teach and they like to help. And yeah, that is what we basically do.
And you found that the research doesn't distract from the rest of the program that the students participating in?
If it does, what the students would normally do is, they would come well ahead of time and explain to us or build up their own relationships with people. And they would explain to us that I have made this contact, this is a contact person's details, you can contact the person, and then go with that person, and then they would be excused from going on that particular rotation or to that particular site on that particular day or two.
I wanted to thank you for coming, and I think this is a great opportunity to begin a new dialogue about how we can all, as a community of educators here in the United States, but also in the developing countries at universities and other health professional organizations, collaborate and work together to achieve the same goal.
It was a great opportunity, Evaleen, and like I mentioned to Steve earlier, for us, myself and Marion doing this trip, it was to get to learn a little bit more about the culture so that we can understand and do our work more effectively and more efficiently in terms of providing a better sort of atmosphere for the student.
Well, we have certainly seen you develop as a professional over the last 5 years or so in incredible ways, and it's really a delight to see you here today. Thank you for being here.
Thank you, Evaleen.
Yeah. Great. Well, thank you both for being here. And again, thanks, Avril, for joining us in San Francisco. And please look for more of us on CFHI.org and on our YouTube channel.